Hello everyone, and it's diagnosis Bona Kuratse Bona, and today we continue hematology, bleeding disorders, and today we will sort out 5 conditions. So some of them have quite mild symptoms, like Henoch-Schonlein purpura or acute immune thrombocytopenic purpura. They are self-limiting and require just supportive treatment. Some of them have quite severe symptoms, like disseminated intravascular coagulation, which requires immediate treatment. So let's start talking about purpura. About these 3 conditions: Henoch-Schonlein purpura, immune thrombocytopenic purpura, and thrombotic thrombocytopenic purpura. Okay, let's start talking about Henoch-Schonlein purpura, and it's an acute immunoglobulin A mediated disorder characterized by generalized vasculitis involving the small vessels of skin, or also GI tract, kidneys, also it could be lungs and CNS. And it often preceded by an upper respiratory tract infection, and there is a classical clinical tetrad. It's arthritis, non-thrombocytopenic palpable purpura, abdominal pain, and hematuria. So for diagnosis, it could be something used to determine kidney function. And skin biopsy is a gold standard, but it's usually not necessary. So treatment, it's just supportive, and because it's self-limiting condition, and so it could be just ensuring adequate hydration, monitoring for GI or kidney complications. Also, we need a treatment minor symptoms like arthritis, edema, fever, or malaise. Non-steroidal anti-inflammatory drugs could be used for abdominal and joint pain, and just in some severe cases it could be used short course of steroids. Immune thrombocytopenic purpura, and it's disorder when there is antibodies against the platelets, and symptoms will be bruising, oral bleeding, and epistaxis. So there is 2 forms, acute and chronic. Acute is usually children and post-viral condition, and it's quite a good prognosis and requires just supportive treatment. Chronic, it's usually women and due to autoimmune disorder, and treatment will be some steroids, prednisolone or rituximab. And so how we can diagnose it? It will be low platelet count, and of course, if you don't have enough platelets, bleeding time will be high. And thrombotic thrombocytopenic purpura, it's also blood disorder characterized by clotting in the small blood vessels due to defect in the ADAMTS13 enzyme, and there is a classical clinical pintate. It's microangiopathic hemolytic anemia, thrombocytopenia, renal failure, and fever, and also neurological symptoms. It could be alteration in mental status, seizures, or hemiplegia or paresthesia. So also will be platelet count will be low, bleeding time high, and treatment will be just it's an emergency situation and requires plasma exchange with fresh frozen plasma. And now let's talk briefly about HUS and DIC. So HUS, there is a typical and atypical. Typical is usually children after diarrhea caused by H. coli, and there is thrombocytopenia, microangiopathic hemolytic anemia, and renal failure. So, and the treatment will be just supportive because these conditions is self-limiting. And also there is atypical HUS, and it's quite similar to TTP, and because it could be adults, and symptoms will be absolutely similar to TTP, and treatment too. So treatment for atypical HUS will be plasma exchange like for TTP. Okay, and DIC, it's a abnormal response of a normal coagulation cascade. At first it will be thrombosis and then hemorrhage. Causes for acute DIC, it will be obstetric complications, also trauma, tumor, sepsis, could be snake bite, and acute pancreatitis. For chronic, it's usually tumor or large aortic aneurysm. And so how I can diagnose it? It will be increased D-dimer and fibrin degradation product, and decrease, of course, will be very low platelets and fibrinogen. So treatment will be plasma exchange and also treatment as a cause of this condition. Okay, and that's all. Thank you very much, and see you in the next video.